Welcome back for another episode of Empowerment and Illness. I am your host, Gwen. Last week, we spoke with DJ on his journey with diabetes and hypertension. His story was very compelling and he got me to thinking about the two. Do they go hand in hand? Today, let's do a deep dive into these illnesses that affect millions of people worldwide. These chronic conditions can be overwhelming, especially for those newly diagnosed. We'll also explore the difficulties of living with these illnesses. So grab a cold glass of sweet iced tea or a cold glass of lemonade. Get cozy and let's get started. There are several types of diabetes people are diagnosed with, like gestational, secondary, maturity onset diabetes for young, and latent autoimmune diabetes in adults. But the most common are type 1 and type 2 diabetes. Type 1 is an autoimmune condition where the body's immune system mistakenly attacks the insulin-producing beta cells in the pancreas. This means that people with type 1 no longer produce insulin, which is essential for regulating blood sugar levels. It's typically diagnosed in children, teen, and young adults, but it can occur at any age. The symptoms often come on suddenly. Living with type 1 diabetes can be challenging, but it doesn't have to limit your life. Many people with type 1 lead active, adventurous lives and achieve great things. It's all about finding a routine that works for you and staying consistent with your management plan. Type 2 diabetes is a condition where the body doesn't use insulin properly. Initially, your pancreas makes extra insulin to make up for it, but over time, it can't keep up and can't make enough insulin to keep your blood glucose at normal levels. This can lead to high blood sugar levels, which can cause serious health problems. Type 2 diabetes is typically diagnosed in adults over the age of 45, but it's becoming increasingly common in younger age groups, including children and adolescents. This rise in younger diagnosis is largely due to factors such as obesity, inactive lifestyles, and poor dietary habits. While genetics can play a role, lifestyle factors are significant contributors to the development of type 2 diabetes. Some of the symptoms for both types are increased thirst, frequent urination, increased hunger, blurred vision, and fatigue. With type 1, additional symptoms may be bedwetting in children who previously didn't wet the bed during the night, unintended weight loss, and mood changes. On the other hand, additional symptoms with type 2 are slow healing sores or frequent infections in areas of darkened skin, usually in the armpits and neck. Because these symptoms can be subtle, many people with type 2 diabetes may not realize that they have the condition until it is discovered during a routine medical checkup or when complications arise. Early diagnosis and intervention are crucial for managing type 2 diabetes effectively and preventing complications. If you're experiencing any of these symptoms, it's crucial to see a physician. Early diagnosis and treatment can make a significant difference in managing the disease. Once diagnosed, the journey begins with managing both types of diabetes. Treatment typically involves lifestyle changes, monitoring blood sugar levels, and medication. Eating a balanced diet and staying active are also key components of managing the condition. Focus on a balanced diet rich in fruit, vegetables, lean proteins, and whole grains. Limiting processed food, sugars, and high-fat items is essential. Carbohydrates have the most significant impact on blood sugar levels. Learn to count carbs and match your insulin dose to the amount of carbs you eat. Eat regular meals and snacks to maintain stable blood sugar level. Avoid skipping meals, which can lead to fluctuations in blood sugar. DJ mentioned how he changed his diet and limited processed foods and sugars, but he still struggled with juices. I've never been diagnosed with diabetes, but I am at a higher risk due to prednisone, and yes, I still struggle with sugars and processed food. Regular exercise helps control blood sugar levels. Aim for at least 30 minutes of moderate exercise most days of the week. A brisk walk around the neighborhood or work is recommended. Maintaining a healthy weight is crucial. Even losing a small amount of weight can have significant benefits. Regular monitoring of blood sugar levels is essential for managing diabetes effectively. It helps you understand how food activity and medication affects your blood sugar. Insulin is the most common used drug for diabetes. It can be administered through injections or an insulin pump. You'll need to check your blood sugar levels several times a day, including before meals, before and after exercise, and at bedtime. Your physician will guide you on the specific times and frequency. Use a blood glucose meter or a continuous glucose monitor, a CGM. A blood glucose meter requires a small drop of blood, while a CGM continuously tracks glucose levels through a sensor inserted in the skin. Nick Jonas of the Jonas Brothers has type 1 diabetes and wears the continuous tracking machine. Maintain a log of your blood sugar readings, insulin doses, meals, physical activity, and any symptoms. This helps you and your healthcare team adjust your treatment plans as needed. It's not just about physical health though. Managing diabetes can be emotionally challenging, so having a strong support system and finding ways to cope with stress are essential. It's not just about physical health though. Managing diabetes can be emotionally challenging, so having a strong support system and finding ways to cope with stress are essential. Work closely with your healthcare team to create a personalized management plan. Consistency and commitment to your health are key. Now let's shift our focus to hypertension, also known as high blood pressure. It is a common condition where the force of the blood against the artery wall is consistently too high. Over time, this increased pressure can lead to serious health problems such as heart disease, stroke, and kidney damage. Hypertension is also referred to as the silent killer because it usually has no symptoms until significant damage has occurred. This makes regular blood pressure monitoring crucial, especially for adults over 40 or those with risk factors such as obesity, a sedentary lifestyle, or a family history of hypertension. However, some people might experience headaches, shortness of breath, nosebleeds. These symptoms are not specific and usually don't occur until hypertension has reached a severe or life-threatening stage. The causes of hypertension can be multifaceted, including both genetic and lifestyle factors. Primary hypertension, the most common type, develops gradually over many years and has no identifiable cause. Secondary hypertension, on the other hand, is caused by an underlying condition such as kidney disease, hormonal disorders, or the use of certain medication. Regardless of the type, managing hypertension effectively is essential to the risk of complications. This management typically involves lifestyle changes and, if necessary, medication. Managing hypertension involves lifestyle changes and medication similar to diabetes. Lifestyle modification plays a significant role in controlling high blood pressure. Adopting a heart healthy diet such as DASH, dietary approaches to stop hypertension diet, can make a big difference. This diet emphasizes fruit, vegetable, whole grains, and low-fat dairy products, while reducing sodium, red meat, and added sugars. Regular physical activity is also crucial. Aiming for at least 150 minutes of moderate exercise per week can help lower blood pressure and improve overall cardiovascular health. Additionally, maintaining a healthy weight, limiting alcohol intake, and avoiding tobacco products are important steps in managing hypertension. When lifestyle changes are not enough, medication may be prescribed to help control blood pressure. These could include diuretics, beta blockers, ACE inhibitors, calcium channel blockers, and others, depending on the person's specific needs and health profile. It's important for you to take your medication as prescribed and have regular follow-ups with your physician to monitor your blood pressure and adjust treatments as needed. Managing hypertension is a lifelong commitment, but with the right strategies and support, you can effectively control your blood pressure and reduce the risk of serious health complications. Regular blood pressure checks are the only way to know if you have hypertension. Early detection is crucial for preventing complications. Living with a chronic illness like diabetes and hypertension can be incredibly challenging, requiring constant vigilance and a proactive approach to health management. For many, the journey begins with the period of adjusting and learning, understanding the intricacies of each condition, such as how food, activity, and medication affects blood sugar levels and diabetes, or how stress and diet influence blood pressure and hypertension is crucial. This learning curve can be steep, but gaining knowledge empowers you to take control of your health. It's important to remember that managing these conditions is a marathon, not a sprint, and patience and persistence are key. Setting routines can sometimes feel overwhelming and intrusive, but they're essential for preventing complications and maintaining overall health. The consistencies of these routines help create a sense of normalcy that can make the management of these chronic illnesses more manageable over time. Emotional and mental health are also significant aspects of living with diabetes and hypertension. It's common to experience feelings of frustration, anxiety, or even depression due to the constant attention that these conditions require. Having a robust support system of family, friends, and healthcare team can make a significant difference. Joining support groups or connecting with others who have similar experiences can provide emotional support and practical advice. Mental health professionals can offer strategies for coping with the psychological burden of chronic illnesses. Taking care of one's mental health is just as important as managing physical health. It's important to focus on positive aspects and victories in managing these conditions. Celebrating small achievements such as reaching a target blood sugar level or maintaining consistent blood pressure reading can boost motivation and morale. Advances in medical technology, such as continuous glucose monitors for diabetes, which I mentioned earlier, and home blood pressure monitors, have made it easier to track and manage these conditions effectively. By staying informed about new treatments and technology, you can take advantage of the latest tools to improve your quality of life. A key lesson learned from those with diabetes and hypertension is the importance of self-compassion. It's okay to have tough days. What's important is to stay committed to your health and not be too hard on yourself. If you've recently been diagnosed with diabetes or hypertension, it's natural to feel overwhelmed and unsure of where to start. The first and perhaps most important tip is to educate yourself about your condition. Understanding the basics of diabetes and hypertension, how they affect your body, and the importance of managing them can empower you to take control of your health. Don't hesitate to ask your physician for resources or recommendations on where to find reliable information. Books, reputable websites, and support groups can all provide valuable insights and support. Creating a structured routine is crucial for managing both diabetes and hypertension. Building a support network is another key tip for newly diagnosed people. Take care of your mental health and emotional health. Celebrate your progress, no matter how small. And remember, managing diabetes and hypertension is a continuous journey. With the right tools, support, and mindset, you can live a healthy and fulfilling life. Before we leave, I would like to close with a special portion of the show I call Healing Heartbeats. This is where we allow ourselves to wallow in sorrow Give yourself 3 minutes to laugh, cry, scream, cuss, or just sit in silence. Whatever you need to do to feel, do it. Let the depression in for only 3 minutes. Once you've reached 3 minutes, compartmentalize it and get back to living. This is a rinse and repeat behavior. You cannot let depression take over, because when it does, it will not let go. When you hear about the passing of someone, they had the day that they were born and then the day they passed away. There is a dash in the middle. It's not a long line, but a short dash. That dash represents your life. Go live in spite of having a chronic illness. Don't let it stop you. You have to continue to go. You have to continue to move. Count your wins. Live your life. That's all for today's episode of Empowerment in Illness. I hope you found this discussion on diabetes and hypertension informative and empowering. Remember, you have the strength, the support, and the heart to continue your journey. Be safe.